sit facing this way, see, they just sit normally like that, yeah. Okay, so for the cervical instability test, you're going to be behind the patient, and basically what you're doing is, what I'm gonna do here is, I'm finding, palpating again to try to find where C2 is. So you can either, find the first palpable sinus process or count it from C7. So once you feel like that once it's been found, then your fingers go over this, overlapping like this, and then the rest of your fingers go to kind of stabilize around where the shoulder blades are. So that you've got you're stabilizing here, and then you're gonna put your hand on the patient's forehead, and then retract it back, push back. So you're basically pushing the head back, so that you're basically moving C1 onto C2. And a positive test is going to be a clunk. So if you feel that stepping over or that kind of like a clunk, you know they've got instability where the axis is moving too much on the atlas. So there's too much movement of the axis on the atlas, so that test would be positive. So
What type of force are you placing on it?
Huh?
What type of force are you placing on it?
Hey, just like this, like retraction, like we did.
Okay.
You're just pushing, instead of pushing here, you're pushing here. And retracting the head back like a cervical retraction exercise. Instead of inducing the pressure here, you're inducing the pressure at the forehead. Oh, yours is easy to try. So then I'm here. And here. And it's not extreme, it's just firm pressure, but I'm not pushing her forward. I've just got firm pressure there, but not like moving the head forward. And then once, and I'm just doing that gentle push back. And see, it's negative, obviously for Maddie, because you've got that firm stop. Okay, but if I had that clunk, that would be a positive test for atlantoaxial instability. And what that means, again, is that same medical emergency, that needs to be checked out immediately. It's positive. What are PTAs, again, with doing this one? The only one by law you cannot do is the vertebral artery test. This one you can do, but most often, the only time you're gonna be doing this one is in the presence, because make sure you know this difference. And Dr. Davis, he and I talked about this, and we need to make this a little bit more clear about special testing and if asked to do these tests. This is one where your supervising PT would have to be in direct line of sight, like right beside you, and saying, hey Tessa, I've got a positive C1, C2, or cervical instability test. Can you redo it to see if you're also getting that clunk, the positive? And they're standing right there with you. And so you cannot do it if they're not physically present. But if they're by phone call and ask you to do like a patellar grind and the peripheral special test, then yes, you can do that. But this one you cannot do these, and you just can't ever do the vertebral artery. And the other ones, this one's the only one we're doing, but there are other cervical instability tests that holds true for as well. Any cervical instability test you can only do in the direct site of your supervising PT. And rarely will they even be asking you to do that, because if something again would happen, it's their license. So why are they having someone else really do it? The majority of the time, but it's not that you can't. Now, can you say I would rather not in that instance? Test the patient's supine for this one. And can you take that hoodie off? Yeah. I'm gonna have Maddie lay supine. Well, you can look at this now before you lay down. What I'm doing here, and this is gonna be difficult for you. I hate how he's just falling apart. So, got some work done on him. So what I'm gonna be doing is I'm gonna be behind Maddie, and my thumbs are going to be right sub-clavicle level. So I'm just gonna be having my thumbs, I'll find her clavicles, so you'll palpate your partner's clavicles, and then you'll drop down. See how I'm just dropping down on the first rib. So then you're gonna have to put deep pressure down so you feel, and it'll feel like it won't feel real hard though, it'll just feel, I want to say like a bunch of vascular structures in there, because you're feeling those vascular structures that are in this anterior triangle too. So you'll feel some of that tissue, but it'll feel like you can't really, it'll feel though, you'll feel the prominence, it just won't feel as prominent as the clavicle because of this bony ridge here that's on the clavicle. There's not, the ribs are flat, and it's hard to feel any protuberance, any kind of protuberance here. So you're palpating, and once you feel like you're on those, you're going to just kind of feel to see, does one feel higher to you before you even have them breathe? Because what you're going to have to do once you find them, then you have your patient inhale fully and then exhale. And the positive test is uneven deviation of the rib. Because when they breathe in, because everybody, you know, kind of just feel here, feel your ribs here. And when you breathe in, what happens to your ribs? Do they depress or elevate?
Elevate.
They elevate. So that's what all of the ribs do. So this one should be moving up and then moving back down. So what do you think a positive test would be? If it's elevated, then it's not going to do what? Move as much, because it's already up. So decreased movement upon inhalation is a positive test for an elevated first rib. Decreased movement, and two, if it has decreased movement, it should be more prominent at rest. So let me see what yours feels like, Manny. And see, I'm just finding her clavicles, and I'm just gonna dip down into that. And like I told you, you'll feel, what do I feel right now already? Yours is so strong. What do I feel? It's strong and regular.
Oh, the artery.
What artery?
Yeah, I know. I'm trying to think of it.
Is it the subclavian?
Yes, the
Yeah.
subclavian artery. Wow, yours is really superficial. So, I'm not gonna press down real hard on hers. Let me have some extra, Maddie. I've never kind of straighten up. Okay, the body part's in your way. So if you do feel, I already feel a pulse like that, would you want to go ahead and do the test and occlude her subclavian, her arteries? No, so that's, if you are practicing this and feel, you can already feel the pulse, then do not continue. And move a little closer. So I'm gonna find Gracie's clavicles here. And then you have to put deeper pressure so till you can kind of feel the where you meet resistance feel like a bony. No, that's probably irritating, isn't it, Gracie?
It's okay.
Okay, now breathe in and breathe out. And breathe in and breathe out. And you should be able to feel that excursion of the rib going up and down into your thumb. So breathe in and breathe out. One more time. And a lot of times, even if you don't feel like you feel more of the neurovascular structures, you know you're in the anterior triangle. So I will put pressure to at least I can feel those. And then once you have them breathe in, then you can feel the rib. So why don't you all, when you're practicing that, just try it that way, where you can kind of feel those nerves and arteries underneath your thumb, then have them breathe in deeply and breathe out, and the rib should become more prominent that way. And again, a positive test is if you have one that's more prominent at rest and then less movement with inhalation. Okay, so those are down to the first rib mobility test. I'm going to have you all now look in your books for the thoracic outlet tests that are listed there. And go ahead on your partners just so you can get it move around, practice those, and we'll come back together and I'll do them